There is a tendency for the number of cancer patients to increase in the world. According to official data, over the last 10 years alone, the increase in oncology has been approximately 15%. Every year, the disease takes the lives of millions of people around the world. Cancer can occur in absolutely any organ or tissue. The world has not yet found an effective treatment for this disease. However, if the disease is detected at an early stage of development, then there is a real chance to defeat it. It is very difficult and sometimes impossible to cope with the disease at a late stage. Therefore, it is important to know how cancer manifests itself and begin its treatment in a timely manner. Oncological diseases are insidious. They have no specific manifestations. There is no symptom that would clearly indicate that a person has cancer. Most often, such symptoms are associated with other diseases, so it is important to pay close attention to your health. If unusual, wrong sensations persist for 2 weeks or longer, you need to visit a doctor and undergo an examination. Causes of the disease. Cancer is the uncontrolled growth of cells in the body. This disease is a malignant tumor that can appear in any tissue or organ of the body. Since the signs of cancer appear very late, it is very difficult to diagnose the disease at an early stage. Therefore, studying the causes helps doctors identify patients who are at risk of developing oncology. These include people who often come into contact with toxic substances, suffer from alcoholism, abuse tobacco smoking, have a hereditary predisposition. Such people are prescribed regular examinations that help to identify the problem immediately after it occurs. The risk group also includes people who suffer from precancerous diseases. The following ailments can transform into a malignant tumor: liver cirrhosis, mastopathy, cervical erosion, hyperplasia. Cancer symptoms also vary depending on the causes of the disease. Experts distinguish 3 main groups of factors that contribute to the development of oncology. The first includes physical effects on the body, for example, excessive exposure to ultraviolet light and radiation exposure. The second group includes chemical factors. These include the effects of various carcinogens on the body. The third group includes dangerous viruses that can cause cancer. For example, the following can cause malignant organs: hepatitis B and C, papillomavirus, adenovirus. Signs of cancer. 16 symptoms that cannot be ignored. 1. Persistent chronic cough and sputum with blood. These symptoms are most often associated with infectious and allergic diseases of the respiratory system, such as bronchitis or sinusitis, but can be caused by lung, head, and neck cancer. If the cough bothers you for more than 2 to 3 weeks, you should see a doctor, especially if it is accompanied by hemoptysis. And remember that lung cancer can develop even in non-smokers. 2. Changes in bowel function. With malignant tumors of the colon and rectum, symptoms such as diarrhea or persistent constipation. After defecation, it seems that the intestines are not completely emptied. If the tumor narrows the intestinal lumen, the stool becomes thin as a pencil. Most often, these symptoms are associated with the nature of the diet, insufficient fluid intake, hemorrhoids, and other non-cancerous diseases of the intestine. You should see a doctor if the problems persist for several days. 3. Bleeding from the anus, blood in the stool. This is a typical symptom of hemorrhoids, but sometimes it indicates cancer. Even if a person knows that he has hemorrhoids and blood began to flow from the anus, you need to get checked. Rectal cancer is the third most common cancer in women. 4. Anemia. Anemia is a condition in which the level of red blood cells in the blood is low. If the analysis showed such a disorder, you need to understand the causes. There are different types of anemia. Iron deficiency is the most common. As a rule, it is caused by acute or chronic bleeding. If we talk about oncological diseases, then in most cases, the number of red blood cells decreases with colon cancer. 5. Changes in the mammary glands. Every woman is recommended to conduct a self-examination of the mammary glands once a month. If you find a lump in your breast, do not immediately panic. Most often, this is not cancer, but benign processes such as fibroadenomas and cysts. But you still need to get checked. Visit a mammologist. The correct diagnosis can be established by mammography, ultrasound, MRI of the mammary glands. The most accurate diagnostic method is a biopsy, when the doctor inserts a needle into the node, obtains a certain amount of tissue, and sends it to the laboratory for histological examination. 6. Dyspnea frequent, painful urination, weak urine stream, blood impurities. These symptoms are in most cases caused by cystitis, more common in women, benign prostatic hyperplasia in men, urolithiasis. But sometimes they indicate bladder cancer, prostate cancer, or other tumors in the pelvic area. 7. Hoarseness. The most common causes of this symptom are laryngitis, vocal cord polyps, and allergies. If hoarseness is not associated with a cold and persists for more than 3 to 4 weeks, you should see a doctor. 8. A lump in the scrotum in men. All men are advised to perform a monthly self-examination of the scrotum. In 90% of cases, a painless lump is found in testicular cancer. Sometimes the scrotum increases in size. These symptoms can also be caused by other conditions, such as varicocele, inflammation. 9. Changes in lymph nodes. Lymph nodes swell with some infections and usually return to normal size within a few weeks. If after 3 to 4 weeks the node is still enlarged, you should see a doctor. This may be a sign of cancer. Women should pay special attention to the lymph nodes in the neck and armpits. They are most often affected by breast cancer. 10. Heartburn. This is a very common symptom. Usually it is not dangerous, but if severe heartburn continues to bother despite taking medications, it is necessary to conduct an endoscopic examination of the esophagus, stomach, and duodenum. 11. Difficulty swallowing. With malignant tumors of the esophagus, it becomes difficult for the patient to swallow solid food. 12. Unusual discharge and bleeding from the vagina. A woman who has the following symptoms should undergo an examination. Bleeding between periods after sexual intercourse. Menstruation that lasts 2 days longer than usual, returning soon after it ended. Postmenopausal bleeding, after a woman has not had a period for 12 months. Discharge with an unpleasant odor. All of these symptoms may be early signs of body or cervical cancer. 13. Weight loss, fever, and night sweats. Most often, sudden weight loss, more than 5 kilograms, indicates an elevated thyroid level. Fever and night sweats are symptoms of many infections, but sometimes these nonspecific symptoms are associated with cancer. 14. Bloating. Bloating, early satiety, changes in the frequency of urination, pain in the lower back and pelvic area are possible symptoms of ovarian cancer, one of the most dangerous oncological diseases. 15. Changes in a mole or wart. Every person needs to regularly examine their skin, monitor the condition of moles, especially those that are large. If a mole has some signs, you need to see a doctor. Asymmetry, uneven, fuzzy edges, uneven coloring, rapid increase in size, change in appearance. Take care of your health. If you have unknown symptoms, visit a doctor immediately. There may be no reason to panic, but you need to understand the reasons and not ignore it. Subscribe to the channel if it was useful. Thank you.